Hey everyone, so this lesson is about amoebiasis, otherwise known as Entamoeba histolytica. So in this lesson, we were going to talk about how we can get infected with this, what are the signs and symptoms, the pathogenesis, and how we can treat it. So Entamoeba histolytica, it is an invasive enteric protozoan infection typically begins with the ingestion of matured and quadrinucleated cysts found in fecally contaminated food or water. Excitation occurs in the small intestine with the release of motile trophozoites which migrate to the large intestine. In the Philippines, is 0.797%, which is lower than previous studies done on estimating the prevalence of E. histolytica using the various techniques, and 35 to 50 million infected worldwide annually. So there are the types of the species of Entamoeba histolytica. There are Entamoeba dispar, Entamoeba moshkovsky, Entamoeba pollici, Entamoeba coli, and Entamoeba hartmanni. And the most common is the Entamoeba histolytica. So how we get infected with this amoeba? Well, there's a cyst stage of infection, that's the infective stage, and there's also a trophozoite stage, which is the stage of the amoeba that actually causes the invasive disease. So we get an infection from ingestion of the amoebic cyst. So the amoeba during the cyst stage, that is infective stage, we can get this from the contaminated food or water. We can also from fecal route, as well as so if an individual has an infection with Entamoeba histolytica. They will actually release mature cysts in their feces, and then if another individual comes along and actually ingested contaminated food or water that has been contaminated with these cysts, they're going to get infected themselves. So there are several stages of infection. So again, the cysts are the infective stage. They are what we ingest from the environment, and when these cysts pass through the stomach, they will transform into trophozoites in the small intestine. This is what is the cause of the invasive disease. So the trophozoites themselves will invade into the mucosa of large intestine. So they pass through all the small intestine, they make it to the large intestine, and then they start to cause damage to the tissue, causing increased secretion and eventually bloody diarrhea. So what are the source of Entamoeba histolytica? So histolytica infection can occur when a person puts anything into their mouth that has touched the feces of a person who is infected with E. histolytica. Swallow something such as water or food that is contaminated with Entamoeba. So what are some of the clinical features of Entamoeba histolytica? You can actually have an asymptomatic picture. So if you have a good immune system, if you're exposed to this amoeba, you might not even have these symptoms if you're able to clear the infection. The other one is the amoebic dysentery. The dysentery involves abdominal pain and colitis. They can get bloody diarrhea from this. And again, bloody diarrhea is due to local tissue damage and destruction, and in addition to amoebic dysentery, you might also the amoebic abscesses, and these abscesses will commonly occur in the liver. These are due to hematologic spread. So if you get an infection in your GI system, they can actually spread hematological to the liver and set up shop. There you're gonna get hepatomegaly, the right upper quadrant pain, weight loss, and fever. So how do we make diagnosis and how do we treat amoebiasis? So investigation and diagnosis include the following. So we do serology. We can look for antibodies against the Entamoeba histolytica. We can do antigen testing. We can do stool sampling, looking for those trophozoites always we talked about before. And we need to do a biopsy of the colon because this amoeba can burrow into the intestinal mucosa. You might have to actually take a piece of the colon to actually look at it under microscope to see these organisms once you've made a diagnosis. How do we treat the amoebiasis? So the treatment involves using the metronidazole. So if we got intestinal, maybe just the GI symptoms of amoeba infection, we can use metronidazole to help to clear the infection. If we have, more invasive picture, more systemic illness, perhaps cysts, more invasive disease, we might have to use eudokinol or the paramycin. So, how to prevent and control the entamoebic histolytica? So, to help to prevent the spread of amoebiasis around the home or individual, wash your hands thoroughly with the soap and the hot running water for at least 15 seconds after using the toilet or changing a nappy. Then, clean the bathrooms and toilets often. Pay particular attention to toilet seats and taps.